Oh, hi everybody. Well, I don't know if anybody is watching because I need to pull up my channel so I can see any possible chat situations going on. Let's see. Let me mute this. Okay. And I'm going to move this over here to my other screen. Okay. All right. Okay, I have one person watching. So I'm just here drinking a summer ale in Chile. Feel free to participate in the chat. I guess I should better explain why I have the title of this video that I do. So it's called Better When We Work Together. And I am going to be talking about COVID-19. I am going to be talking about the current global pandemic, what's been labeled as a pandemic. Isabella Noonan. Hello, I'm in New Zealand working from home today. Yeah, I think a lot of people, hello, welcome to the chat. I'm sure a lot of people are working from home today. How is my audio? If anybody would, and the video quality, I'm using my cell phone, so hopefully the video quality is better than when I use the camera that's built into my laptop, because the quality is not good at all with that one. How is everybody doing? It's been real, y'all. It's been real. Let's see, audio and video is good. Thank you so much for letting me know. I also, just a warning, I don't have any moderators. I haven't set anything like that up or asked anybody to help me out with that, so I'll try to keep an eye on the chat to make sure that no nastiness is present. I've seen several other members of our Witchy Pagany community also making live chats and videos, checking on everybody, and I think that's just really, really important. Let's see, Emily Diamond, hiya, popping in to say hello, but will not have much time to watch back. As it's bedtime in the UK, hope you're staying well. I hope you're staying well too, and definitely, like, if you need to go to bed, get some good sleep. Like, now is the time for self-care. Now is the time that we have been preparing for with our self-care, self-love practices, right? If we can afford to. Actually, the kind of economic element to all this is something that I want to get into as this, video kind of develops and as I get my ideas out. I'm putting some hand cream on right now because my hands, I'm sure you guys can relate, are dry as fuck because of all the washing and all of the alcohol-based hand sanitizer. We are lucky enough to still have a few little travel-sized bottles of hand sanitizer. We had one from before all this started going down, at least in my neck of the woods. But we were lucky enough to find someone selling some on the street for 1,500 pesos. 2 little travel size hand sanitizers, so we definitely got one each. Yeah, I just wanted to see how everybody was doing and kind of share my thoughts, and in sharing my thoughts through the chat and in the comments section, also give people space to share their emotions and thoughts if they want to, of course, so that I can also process my thoughts and emotions about this, because this is within my living memory anyway, and a lot of people's living memory. This is one of the worst kind of disease, epidemic, pandemic situations that I can think of. I know polio was a thing maybe a generation or, well, a couple generations ago from me, more like my parents and my grandparents' generation, and then the Spanish flu and influenza in general, and it's just it's a new experience for a lot of us, I guess is what I'm saying. So why did I choose this title, Better When We Work Together? And something that I've been kind of reflecting on lately, especially since things have gotten more and more serious here in South America, it's still nowhere as bad as other parts of the world that have been hit hard by this. I'm thinking particularly of Italy and China and other countries that have the death toll in the thousands, right? The Italy situation is just so frightening. And I think a lot of countries in Latin America, especially the countries in the southern hemisphere that are about or just entered into autumn. Yesterday was the autumn equinox for us down here. And so winter is coming, like Game of Thrones style, winter is coming, flu season is coming, the worst season for respiratory illnesses in Santiago, especially with all the air pollution, is coming. And so I don't know what the spread of this disease is going to look like in 3 months when it's the summer or the winter solstice down here, right? What's the death toll going to look like? So far, Chile, there have been no deaths, but there are, I think, around 342 recognized cases in Chile. And that number, it seems like that number goes up by 100 every day. The government and healthcare workers here are finding more and more and more cases. And I happen to live in Santiago. The population of Chile is around 18 million, but just 7 million of those live in Santiago. So give or take, a third of the country's population lives in this one city. And, I depend on public transportation, and I'm surrounded by thousands and thousands of people in pretty close proximity to me all the time. And I also happen to live in the part of the city that's been affected the most. So I have to admit that I haven't really taken this as seriously as probably I should until this week. Just because I was busy, I felt like the problem was far, far away, although I am incredibly worried for my home country, the United States, which as of today has, I think, over 10,000 cases and over 1,000, maybe close to 2,000 deaths. Keep track of the numbers because they keep going up just so quickly. But I guess what I'm saying is, and where the title of this video comes from is, a call for balance, or at least I've been thinking a lot about balance, and specifically balancing two separate kind of categories of things. The first being a balance between panic and flippancy, which I'll get into a situation with one of our neighbors right here in a minute, not going to extremes in either direction, right? Not taking it so seriously to where, we're living in a state of panic and fight or flight all the time, right? Because that's not healthy. It's not good for our immune system. It also can cloud our judgment. It can really affect our mental health, right? But then on the other end, not taking things seriously enough. And the news here in Chile, one of the local or the Chilean news stations, had an interview with a Chilean woman who lives in Italy. And she basically, the point of the interview was for her to send a dire message and a warning to Chile. She said that, or from her observations, of course, one of the reasons, of the plethora of reasons why the situation is just so bad in Italy as it is. And as I'm recording this, I think there's over 41,000 confirmed cases in Italy and over 3,400 deaths. 41,000 is scary. And she was saying that one of the reasons why the situation is so bad is because people weren't taking it seriously enough when they had a chance to. And she was worried that the same might happen to Chile. And so you have that balance, like trying to think clearly, but also take it seriously enough, but not taking it to a fearful, panic-driven kind of place if we can help it. I know for those of us with anxiety, it's been real. It's been real for everybody. But also, I think there needs to be a balance between a collective-oriented thought and an individualistic, more oriented type of thought or course of direction with this. And now let me tell you and kind of bitch about what we just learned from one of our neighbors in our apartment building and how he kind of took the situation, or at least from his text messages on WhatsApp, it isn't taking this seriously enough. So we literally just, probably an hour or so ago, there was a blackout. We lost power, like several sections of this region of Chile lost power apparently. And so my partner, he is in the apartment building WhatsApp group, and this building only has 6 apartments, 2 on each floor, and we're on the top floor. And apparently one of our neighbors shared that her sister has been confirmed, is a confirmed case of COVID-19. And so because of that, the neighbor is in quarantine in Viña del Mar, which is about an hour and a half outside of Chile or outside of Santiago towards the coast. However, her husband is still here in the building, and he started kind of joking around about it, joking that he was having symptoms. And then when the neighbors reacted saying like, hey, you know, the incubation period for this virus can be up to 2 weeks. You can be in contact with it and you can have the virus without it showing any obvious signs for as long as 2 weeks. Like, what the hell, dude? You know? And I'm not saying that they need to divulge their personal situation to anybody, but being that they chose to share that information with the rest of us in this building, and the way that at least the husband managed it was it just pissed me off so much. And it made me think about like the hoarding of things like hospital masks and the hoarding of hand sanitizer that some people are doing. I think most of the cases I've heard of have been in the US. Hoarding it for the purpose of reselling it and like spiking up the prices and taking advantage of people's fears, right? And real health concerns. I find that pretty disgusting. I've also heard of people refusing to stay in quarantine even though they've been exposed to the virus or they themselves have it. Now, I understand there might be economic pressure to keep going to work. Because, you know, we are living in this neoliberal capitalist world, and, you know, you got to pay the rent and you got to pay your bills. You got to pay for that health insurance that ultimately isn't going to help you at all, you know. But I think there might be also just not enough people taking this thing seriously. And in my opinion, they're not thinking collectively enough, right? And now this binary between individualistic oriented actions and thinking versus collective actions and thinking. I know that binary has been used, you know, by people studying the differences between cultures and societies, but we have to recognize that maybe that binary doesn't inherently exist on its own. It's just a tool for us to explain a phenomenon, right? But let's just assume let's just use that binary between collective and individualistic thinking. And in different cases, in different situations in life, you have to sway from one end to the other, trying not to go too much towards one extreme at the expense of the other, right? For example, individualistic thinking, right, which I relate closely to skepticism, to looking for evidence from reputable sources, that kind of stuff, can be a tool for avoiding falling into the traps of conspiracy theories or dangerous and violent ideologies, for example. And I know there's been a lot of conspiracy theories floating around apparently on the internet, related to like where the disease came from. They're projecting some sort of like economic or political purpose onto the disease, and as a lover of chaos and chaos theory that I am, it just frustrates me so much because it's just so easy to see, like, through evolution and through our interconnectivity as a human species across the planet, like, of course, a disease like this was going to happen. Of course, viruses evolve and change and mutate and can jump from one species to another. Like, of course, like, this was an inevitability. And so, what frustrates me is things like selfish thinking and individualistic thinking, warping this to a political issue, right, for political gain. And I'll get in more into that later. Like, those sorts of things get in the way of mitigating and limiting human suffering, especially unnecessary human suffering, right? Like, suffering is a part of life. Sometimes you're going to feel pain. Sometimes you're going to get sick. Sometimes you're going to. Okay, I'm back. All right. Internet's not the best here. Suffering is a part of. Okay, I'm back. Dario, can you open the door? Sorry, guys. Can you disconnect the TV from the internet because it's getting in the way? It's causing the connection to be bad. I'm gonna turn it up. Yes. Sorry, guys. I don't have the best internet connection here, so hopefully that'll get better. What was I saying? So there's human suffering that's caused by things that is just outside of our control. However, there's a lot of unnecessary human suffering. And when I say unnecessary human suffering, I'm talking about preventable human suffering, or human suffering that is caused by greed, politics, ideology, violence, right? And I think too much of this kind of individualistic thinking, like, I still want to go on spring break and I still want to go down to Florida and party because I'm, a young person and I trust in my health. And I also think that this disease isn't going to affect me or the people I love. I think that's too individualistic, you know? Like, and I think that that could potentially lead to unnecessary human suffering, because just because your body can handle, potentially, theoretically, the disease doesn't mean that you can't then transmit it to other people whose body can't, right? Um, I think it is so incredibly important for us to start kind of, at least for the time being, to start thinking about our health and our well-being more in terms of the collective, right? When we can. Like I said, some people still have to go to work. Healthcare workers on the front line, they still have to go to work, right? Sanitary workers, janitors, the people going around and delivering the mail, low skilled, quote unquote, low skilled labor, those kind of workers, they still have to go out and work, right? Food delivery people, like all these different groups of people and workers that don't have a choice. They can't quarantine themselves, right? So don't get me wrong. I'm not saying that, like, having to go to work is selfish. It's not at all. And especially if you are a first responder or a healthcare worker or a grocery store worker or a pharmacy worker, if you are a person out there on the front line that is still keeping society going, thank you. Thank you so much. Thank you. However, for the rest of us, for those of us who have the option or the ability to work from home, right? For those of us who are students who are on spring break anyway, we need to really prioritize and think about our health in terms of the collective, in terms of those who depend on us. Because even though your body might be fine, you might be a younger person and you might trust your ability to survive this. You know, older people, people with compromised immune systems, people with other health issues, they depend on the rest of us, right? And so to choose to engage in risky behaviors, to choose to not to take this seriously, I find incredibly selfish and just dangerous. It's dangerous. And so my partner and I, this is how we're dealing with this. And for those of you who are here watching, or for those of you who watch this after it's live, I want you to comment down below and talk about the measures that you're taking. Like, how are you? Oh, it's Naji. Hi. I'm glad you made it. What are the measures you're taking? How are you considering other people's needs before your wants, right? Because we're in a situation now where other people's health needs are really more important than our individual wants. And I'm not saying that that's universally the case, but I think this is a particular, really important situation, right? To start to prioritize other people's health needs and well-being above your wants, right? Especially or particularly if you are, if you don't have any pre-existing conditions, if you're not in a high-risk group, if you don't have any immune system issues, right? If you think that, it'll just be a bad cold, I'll stay in my house for 2 weeks and that'll be that. Or, I don't need to report this, or I don't need to get tested kind of thing. Like, you really need to prioritize other people's well-being above just what you want to do or what you would prefer to do. Like, now is the time. This particular situation, now is the time. And so my partner, he came home and he's been working from home since Tuesday, I believe. I always work from home. I'm just writing my dissertation and doing research down here. But today, since last night or yesterday, the president of Chile declared a state of emergency, a catastrophe state of emergency that is going to last 90 days. And like I said, for those of us living in the southern hemisphere, winter is coming. The worst cold and flu season part of the year is coming. And so I don't know. I wonder if in the northern hemisphere, it's Naiji, they say, I'm staying at home. Yeah, I'm staying at home too. Cold and flu season is coming. I don't know if the virus in the northern hemisphere has kind of peaked, and maybe, hopefully, we've seen the worst of it, especially for countries like Italy and Spain and China. Hopefully, like, the climax of the peak has already happened, it'll start going down, but my fear is that in the southern hemisphere, the worst might be yet to come. So anyway, the government here has shut down all national borders. so only Chilean citizens or permanent residents can leave or enter. They've declared a 90-day state of emergency, so that will take us into June, into winter. And I just hope that people here might take it more seriously, but I also hope that governments will start to prioritize people's needs more than the economy, although it's a complicated subject. But I just get the feeling, like, for example, yesterday on the news here, they were saying that that they were going to close down all malls and shopping centers, like only pharmacies and grocery stores were going to stay open nationwide. But then today that didn't happen because there's some insecurities and fears about the economy and how this would affect the economy. But also there's, also very real concerns and fears of the workers of these stores, right? Who's going to cover their bills? Who's going to cover, their expenses? How are they going to make ends meet, right? Yeah. Nettie G says this is affecting local businesses. Absolutely. Local businesses, small businesses, the workers in retail stores, just people worried about how they're going to pay their rent. And I know this isn't particular to Chile. This is happening everywhere because, this is new for a lot of us, right? So my partner's working from home. I usually work from home. So what we did was we went around to all the little tiendas, almacenes in the neighborhood, but also the grocery store. And we stocked up on food. And we just got back. It's probably why I look kind of like greasy and disheveled. I'm covered in sunscreen because we walked down the road to the pet store to stock up on our cat's food because officially a quarantine has not been declared in Chile or Santiago, but we're expecting and hoping actually that a quarantine will be declared. It's actually kind of worrying me that a quarantine hasn't been declared yet, and I have a feeling like figuring out how to keep the economy going or stabilize it or keep it from just crashing is part of the reason why a quarantine hasn't been established yet here. Also, the number of cases is relatively small now, but I can tell you it's gone up 100 overnight, from 200 and something yesterday to over 300 today. And so I'm just worried that in the Southern Hemisphere, in countries that traditionally are, don't necessarily have as many resources as other parts of the world, right? I'm just worried that it's going to be another Italy situation here within a month. And so, yeah, we stocked up on things. We have enough food, and I have enough meals in my head that I know I can cook with the ingredients that I have for 2 weeks. We've decided that unless a quarantine is called, the only reason that we're going to leave the apartment is to go get fresh produce from the feria this Saturday. Washing our hands every time we come back home. If we have to leave the apartment, of course, washing our hands before eating, washing our hands anytime we have to take public transportation. And like I said at the beginning, we were lucky enough to buy a few small bottles of hand sanitizers, so we take that with us. And every time we interact with someone or have a money exchange with someone, immediately with a hand sanitizer. And then when we come home, change our clothes. And I've been doing laundry and trying to disinfect different surfaces and doorknobs and stuff around the house, while also taking the time to take care of myself. Try to make sure I'm getting enough sleep, make sure that I'm drinking enough water, make sure that I'm eating right, Unfortunately, we're not going to go to the gym anytime soon, which is frustrating because we've already kind of been out of our gym routine loop for a couple of weeks since my sister came to visit. You know, that kind of got us out of the routine, and now on top of that, we have this virus situation. But I think, and honestly, this is how I'm approaching it, and this is how I think most people are approaching it. I am practicing social distancing and self-isolation as much as possible and hoping for a quarantine because not because I fear for my health, because I don't have any immune system issues. I'm 32 years old, pretty healthy adult, right? I am fairly certain that if I contracted the disease, I would survive it. However, I don't want to spread it to anybody else, especially to people who might be in more, um, what you call it, who might be in an at-risk category, right? That, that more collective, worrying about the well-being of the collective kind of thinking is something that I've tried to consciously kind of switch my mind to and focus on, especially in the next month or so, especially as the cases in my part of the world keep going up and up and up, right? So for the people in the chat, how, besides staying at home and taking care of yourself, I mean, emotionally, mentally, physically, how's everybody doing? Like in your neck of the woods. I know it's Nayaji says that's my fear as well, which is why it's imperative to self-quarantine and the government should help out people more in need. Oh, I think they were referring to when I was talking about the Southern Hemisphere, because I know they live in the Southern Hemisphere as well in Latin America, in a neighboring country. Well, not directly neighboring, but yeah, it's, winter is coming. Winter is definitely coming. Let me see my notes. I actually took notes for this video. It actually helped me to kind of write it out. I sat down and decided that I needed to make this video because of the situation with the flippant neighbor. And, maybe it came down too harsh on him. Maybe that's his way of dealing with the stress, because I can't imagine being like having that much proximity to someone with a confirmed diagnosis. However, I don't think it's fair to write off the rest of the neighbors' concerns. And now my partner and I are taking more precautions when we are passing through common areas in the building, knowing that he is here and his wife might be coming back, and not knowing if, touching doorknobs and hand railings and stuff, it's a real concern. It's something that we're keeping in mind. Let's see. It's stressful, but to try to stay active mentally, use my tarot, still learning the process, reading fiction and watching Netflix. Oh yeah. I my I've unfortunately I had to take a break from my spiritual practice for a few days because I had some the last few steps of getting my visa ready to go here has kind of swallowed up my past couple of days, and it was just a crazy situation that I don't want to get into right now. But basically, just fears of the coronavirus caused some like crazy shit to go down the past few days at the Registro Civil, which is where I had to go to try to turn in the paperwork so that I can eventually and finally get my national ID with my national like number, like the Chilean equivalent to the Social Security number, kind of. I finally got that done yesterday, and yesterday was the last day I could do it before my paperwork expired. And it was just crazy. It was an insane process that took up a lot of time, and it was so frustrating. But anyway, it got done. But I have been, just using my tarot cards and getting into uh, back into the self-care routine after my sister was here, which that disrupted our routine. I'm hoping tomorrow I'll be able to do some yoga just to stretch out and kind of like stretch out all the tension, because my anxiety, I carry a lot of it in my shoulders. I get really tight, like this. And so a nice 45-minute yoga video on YouTube is just what the doctor ordered for me right now. Balance, yes. Yes, balance and working together and remembering other people when you make decisions, right? Remembering that there are people out there who are vulnerable to this. And just because you aren't one of those people doesn't mean that your actions and your decisions don't matter or can't have an impact on other people's lives, you know? Something I've been thinking a lot about lately too has been how just thinking about what it means to be human in the 21st century and how interconnected we are and how interdependent we are. And we're more connected and interdependent than we think. Um, and I think that's something that this virus is really bringing to light. And it's something that we need to remember. It's a lesson for us to remember. Just really, we're all in this together, y'all. We're all in this together. And so we need to remember that. This is a global issue, and we all have to be together in this. Exactly. Exactly. That's the only way that we're going to flatten the curve. I know that phrase has been thrown around a lot, and it's something to really, really remember and consider, right? We need to do whatever we can, especially for those of us who have the ability to stay at home and isolate by choice, right? We need to make that choice and remember that our decisions can have an impact on someone else's health and well-being, right? We need to learn a lesson. For those of us who are not in Italy or other major hard-hit countries, right? We need to look at what happened and make sure that that doesn't happen again. And for anybody, if anybody who lives in Italy or who has family in Italy or anybody anywhere in the world, period, whose life has been impacted by this, or who has a loved one or a friend or a family member whose life has been impacted by this, you know, my heart goes out to you. And I just hope that I just hope everybody can have access to the medical care that they need, right? Something that also frustrates me too is how this has been turned into a political issue when it's not. It's a human rights and well-being issue. Ro McGee, am I saying that right? Hello all, hope you and your loved ones are okay. Exactly. I'm sure that the president of my country, which is 45, I'm a US citizen, I'm sure he's not the only political leader to use this as an opportunity to spread misinformation and, you know, propaganda for his own political interests. I'm sure he's not alone in this, but he's a prime example of it, at least at the beginning, about, you know, how his administration was initially handling this and how Fox News and the propaganda machine started to try to argue that this was just like some sort of left-wing conspiracy or a mess that the Democrats or whatever were exaggerating or whatever they were trying to say. That disgusts me, because we're all in this together, no matter what part of the world you're in, no matter who you are, your socioeconomic status, you know, your cultural backgrounds. You know, this virus is global at this point. It's global. And a virus doesn't care. It just needs a host, and it needs to be spread to other hosts. That's its purpose, right? So it doesn't care if you're a Democrat or a Republican, or if you live in the United States, or if you live wherever, you know. Another thing that really disgusts me is Chinese and anti-Asian racism that is starting to pop up and has been popping up for a few weeks in the United States. At least that's the examples that I can think of. You know, even Trump is calling it the Chinese virus, and he refuses to apologize for that. But he's also a white supremacist sexual predator douchebag. So there you go. Not to explain or explain away his actions, I still very much hold him responsible, even though he doesn't even hold himself responsible apparently. I think he kind of infamously recently said something along the lines of, "I take no responsibility at all," when a reporter was asking him explicitly about why the what was it called, the pandemic experts or group, you know, in the government were disbanded and fired not too long ago. Anyhow, it disgusts me. This isn't a Chinese virus. This is, you know, a form of coronavirus. It is COVID-19, and it is global, and it can potentially affect every one of our lives. And it already has affected a lot of our lives, but, you know, viruses spread in whichever way that they can, and it doesn't care what your background is or who you are. You're still a potential host for it, right? That man needs so much shadow work, but yeah, I totally agree. I don't know if shadow work is enough. I don't think he can even handle the concept of shadow work. Yeah. Anyhow. There's just, this situation is just so complex, and its impact on our current living reality, but also on the future and what the future is going to look like for a lot of us, is immense and huge. And we, all of us, especially those of us who have the means and the ability to self-isolate, right? And even more so, especially among that group, especially those who do not have any pre-existing health conditions or who are not in an at-risk group, we need to really do what we can to help others. And right now, the best thing that we can do is to isolate ourselves and prevent the spread of the disease as much as we can. I think after this is live, and we're approaching 45 minutes and I gotta go get dinner ready, I will be sure to include in the description box a couple of videos that I found that I found to be really interesting, informative, and helpful. And one is specifically about the signs and symptoms of the disease, based on, you know, reputable sources, based on the research that has been done on the disease since it first popped up in China. And the other video is specifically about mental and emotional health. And I know there's lots of resources out there by now. This is just one of many, but it's something to consider, like, how is this affecting your mental and emotional health? You know, it's scary. It's scary. So I think with that, thanks to everybody who's joined me while I was live. Please be sure to comment, if you want to, of course. Comment either in the chat or below about your experiences. Use this, like, one of my intentions, like I said at the beginning of this video, one of my intentions for this video was just to give space, right? Give online space, virtual space for people to you know, feel less alone, for people to process their emotions, to find solidarity and community, to express themselves, right? As we, as a species, globally, try to get through this together, right? And try to reduce as much as we can unnecessary, preventable human suffering. At least that's my mindset going into this, and I imagine that's the mindset of a lot of people. It's just, you know, there's a sour or a rotten apple in every barrel, whatever the phrase is, right? Rue McGee said, I can recommend Naomi Klein's new video called Coronavirus Capitalism. Oh, yes. I think I came across that in my Facebook news feed. Someone posted that. That's something, too, that disgusts me is like using this as an opportunity for profit. And sure, it is annoying when someone stocks up on thousands of bottles of hand sanitizer. Not just annoying, it's dangerous and unethical, right? They stock up on thousands of bottles of hand sanitizer with the intention of hiking up the prices and trying to make a profit off of it on the internet. But I do think more of our attention needs to be paid towards greater and larger powers and systems that be. You know, how is the medical industry, like some of the negative aspects of the medical and pharmaceutical industry, how might they be trying to exploit this? I'm really interested in that video. Thank you for recommending that. I'll definitely be sure to check that out because that is a very real concern and problem. Yeah.
Remember the blessed alcohol that in Argentina passed away?
Oh, my partner was reminding me, good God, like another way that an individual person is trying to capitalize on this. There was an evangelical pastor in Argentina, apparently, they showed this on the news here, who was claiming that he was trying to sell blessed, am I back yet? So yeah, this pastor in Argentina trying to capitalize on people's fears and anxieties about the disease. It's just disgusting. But I do think we need to pay attention to the bigger powers and how they might be trying to exploit this for their gain. So with that, again, thanks to all who joined me for this live chat and thank you for participating in the chat, but please comment below. Use this as a space to process what you need to process. Please do not feel like you're alone, and please do what you can to flatten the curve. Check out the resources down below, and until next time, I wish you and hope that you are healthy and that the people you love are healthy and that we get through this together because we work better when we work together. Okay. Stay safe and stay healthy, guys. Until next time. Bye.